So coming to the next topic, we are going to see malignant melanoma of the choroid. Okay, malignant. The word itself says it is a malignant. Melanoma means pigment. Choroid you already know. Sclerochoroid retina, 3 layers. You will see types, pathology, clinical features, differential diagnosis, treatment of malignant melanoma. Okay. Introduction. Incidence 85% among the UL melanomas. Okay, and age is 40 to 60 years of age. Okay, it is more seen in older people. Sex is both sexes are equally. Race common in whites than in blacks. Okay, side temporal half of the temporal half of the choroid. Seen on the temporal side of old age people, 85% of UL melanoma. Okay, rare in it is common in whites. Types: circumscribed type and diffuse type. Okay, circumscribed type means always it is primary, single unilateral pigmented, but metastasis from melanotic growth is unpigmented. Okay, the primary sites will be pigmented, but the metastasis will be unpigmented cells. Okay, you can see diffuse type, salty gray pigmentation in the retina. Okay, this is the picture, salty gray pigmentation in the retina. Next, one more picture is the circumcised malignant melanoma of choroid. You can see it is like circumscribed to a single region, not diffuse type. Okay, diffuse means it is like diffused. The word itself says diffuse means like it is diffuse, not clear margins are present. Okay, what are the pathology of this malignant melanoma of choroid? Okay, pathology is by Calendar's classification, that is histological classification: spindle cell melanoma, epithelioid cell melanoma, mixed cell melanoma, and necrotic melanoma. Based on what cells are seen in melanoma, it is divided. Okay, clinical features: mostly symptom free onset. Later, visual impairment appear with involvement of the macula with extension of retinal detachment. Okay. Now, what coming to the stages of the tumor? It is divided into 4 stages: coesequent stage, glaucomata stage, stage of extraocular extension, stage of metastasis. Okay. Just now we have read the same stages in retinoblastoma, same to same. Coesequent stages, glaucomata stages, stage of extraocular extension, stage of metastasis. Okay. First, coming to the coesequent stage. Okay, tumor arises from the outer layer of the choroid. As a choroidal tumor is there, we will see in choroid only. Lens-shaped mass pushing the retina over it. Okay, lens-shaped mass pushing the retina over it. Okay, orange patches appear in retinal pigment epithelium due to lipofuscin accumulation. Okay, lipofuscin is a pigment. Okay, becomes collar button or mushroom shaped when membrane of Bruch is ruptured. Causes retinal detachment around the tumor mass even though the retina remains in the contact with it. Okay. Here chances of tractional retinal detachment is more. The tumor presses the retina from backside. Okay. Next, coming to the glaucomata stage, severe pain with visual deterioration due to increased intraocular pressure. As the tumor is pressing, that's why there is an increased intraocular pressure. Secondary glaucoma due to compressed of vortex veins and blockage of drainage channel, direct invasion of anterior chamber, obstruction of angle of anterior chamber by melanin pigment following tumor necrosis. Okay. The tumor cells will go and lodge in the trabecular meshwork and block the drainage of the aqueous fluid. Therefore, there is a glaucomatous condition. Okay. Stage of extraocular extension means the tumor spread through the scleral emissary channel into the involved bulbar surface of the orbit, and direct invasion of the sclera and retina means comes out of the eyeball. Stage of metastasis, that is hematogenous spread. Other distant organs involved, mainly liver. Differential diagnosis of malignant melanoma of choroid are benign melanoma, hemangioma of the choroid, rhegmatogenous detachment of the retina, choroidal detachment, parasitic cyst of choroid, old choroidal hemorrhage. Okay. Diagnosis is by indirect ophthalmoscopy, slit lamp biomicroscopy with fundus and contact lens, transillumination test. Okay. On doing transillumination test, it will be negative. Okay. Fluorescein angiography, radioactive phosphate, that is 32P uptake. B-scan ultrasonography used when media is hazy or to exclude rhegmatogenous retinal detachment. Okay. Prognosis, good prognosis if spindle cell melanoma, that is 81% survival rate, 10-year survival rate. Poor prognosis if epithelial cell, mixed cell or necrotic or diffuse type, less than 40% or 10-year survival rate. Okay. Treatment. Now coming to the treatment, conservative for small melanoma, enucleation for large tumor with visual impairment, photocoagulation, tumor less than 10 mm width, if less than 3 mm with elevation. Okay, tumor not located near fovea, subretinal fluid. Irradiation, radioactive plaques, cobalt 60 or ruthenium 106 are used. Okay, irradiation. Local resection for peripheral located tumors. Cryotherapy minus 60 degrees Celsius, that is cold we will use. Done for primary procedure, secondary to photocoagulation. We will give palliative treatment, that is chemotherapy and radiotherapy along with systemic metastasis. Okay. First, we will be conservative for small one. Enucleation we will do. Then we will do photocoagulation. So to prevent the retinal detachment. Then we will do local resection if it is located locally. Then cryotherapy we will use to reduce the size. And for secondary to photocoagulation also, we will do palliative treatment for systemic metastasis. Okay. Shall we finish exenteration along with it? Okay, short note on exenteration. It is short only. It is a surgical procedure in which total excision of the orbital contents, including eyeball, extraocular muscle, fat, and periorbital, and the eyelid is done to remove a malignant growth that has the advance so much that it cannot be treated by irradiation or conservative surgical procedure. Okay, means here only the orbit is seen. Okay, even the eyelid, the eyeball, even eyelashes of the orbit, everything is removed. Okay, sclera, choroid, retina, extraocular muscles, everything is removed. It's completely empty eye. Okay. Indications of exenteration are extraocular extensions of retinoblastoma, malignant melanoma, okay, squamous cell carcinoma of the eyelids involving bony orbit. So we'll do exenteration. That's it. It was only short one exenteration. It was simple thing. So see you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.